Hi, good afternoon. I'm Elise Minton with New Beauty Magazine, and we're here live at the American Society of Dermatologic Surgeons in New Orleans. And we have something very special planned today. We have Dr. Ann Zedlitz from Baton Rouge, Louisiana, who's going to be answering all your questions that are coming in live about CoolSculpting. But before we get to the Q&A portion of this segment, we have Dr. Sarah Jackson of Audubon Dermatology, who's treating her patient Jean, who's having CoolSculpting done on her abdomen. And we are going to have a live CoolSculpting demonstration done right here. So, Dr. Jackson, why don't you tell us a little bit about what you did to prep Jean and what's happening next?
Okay, thanks, Elise. So this is Jean, our patient, and she came to our office, and her area of greatest concern was the lower abdomen. So what we've done is we've cleansed the area. She's been marked in her area of greatest fat, and then we have the gel pad in place, so we are ready to begin our treatment. All right, Jean, so I'm going to put the vacuum on here, and you're going to feel a little tugging sensation, okay? And I'm just going to get situated here. And Jean's going to feel, as the vacuum comes on, that slight tugging sensation. How does that feel?
Great.
Okay, good. Let me just get our pillow in place. And then once we have the pillow in place, we're going to go ahead and begin the cooling. And once we turn the cooling on, we're going to go ahead and go.
Okay.
So as the cooling begins, Jean feels a little cooling sensation, and then after 5 or 10 minutes, she's going to be completely numb and comfortable during her session.
And that's it? She's good to go?
That's it. That's our CoolSculpting, and she's going to be here for about 35 minutes in place and totally comfortable. How does it feel now?
Just fine.
Okay, good.
All right, cool. So we are going to check back in with you guys maybe halfway through, see how you're doing, if you feel anything at all, and just tell us what the experience is like.
Great.
All right. So, Dr. Zedlitz, let's get to some of the questions that have come in. We got a few already. Our first one is from Angela, and she asks us, what exactly is CoolSculpting?
All right, Angela, CoolSculpting. Well, it's the only FDA-cleared non-invasive procedure to get rid of stubborn fat using a cold technology where it actually freezes the fat away.
So what happens to the fat during the treatment?
The fat cells are frozen, and then over the next 1 to 3 months, the body generally or gradually eliminates and processes the fat in the dead cells and eliminates it naturally from the body.
Okay. We also have another question that came in a few moments ago from Debbie, and she asked, are the results long-lasting, and how soon will I see them?
Great question, Debbie. So yes, the results are long-lasting and durable. When the fat's gone, it's gone. Bye-bye, don't come back, right? So the very, very long-lasting results. And then, what was the second part of the question?
How soon will I see them?
So the results, generally, you start seeing them pretty quickly, 3 to 4 weeks. And then the full results are at 3 months. So 1 to 3 months, start seeing the results at 1 month, and full results at 3 months.
Okay, I'm sure everybody asks you this question when you have a patient come in for a consult for CoolSculpting is, will I gain the weight back? Will the fat come back?
Okay, great question. You won't gain weight back unless you eat more, all right, or exercise less. But the fat, if you do gain weight or do gain more fat, it is distributed preferentially on to other fat cells. So you don't, let's say we treat under the chin, you have 20 to 25% less fat there under that chin. So you don't have the fat cells there anymore for the fat to deposit in those areas that are treated. Does that make sense?
Yes, but that's not to say that it can't go elsewhere?
It can go elsewhere. Sure, but it won't. You're genetically predisposed to carry your fat cells wherever your mom and dad genes told that fat to go. So if you're genetically predisposed to carry it on your chin and you treat that area, then yes, it's going to go somewhere else, which is good.
Okay.
That's your problem area, and you don't want it to come back there.
Sure. All right, we got another question from Christina who asks, is the CoolSculpting procedure safe?
Oh, extremely safe, exceedingly safe. It's probably the safest procedure I have in my office. Over 3 million procedures have been done in over 70 countries worldwide. 3 million procedures. That's huge. So safety,
Vacuumed.
I don't know of any other procedure that I offer or that's out there that's safer.
Who would you say is a good candidate for CoolSculpting?
I like a patient. Ideally, the candidate is it's near their ideal body weight. So, and you don't, because it's not a weight reduction procedure, it's a targeted treatment to areas of unwanted or stubborn fat. again, that goes back to those genes and your genetic predisposition. Where do you carry your fat? So if it's in the love handles, you treat the love handles. You know, peri-umbilical, around your belly button, you treat there. So it's more of a targeted area for stubborn fat and not a weight reduction. So again, at or near your ideal BMI, body mass index, or your ideal body weight.
And do you ever have patients come to you that have had a procedure like liposuction before and want to get CoolSculpting done?
Yes, all the time actually. And usually the liposuction patients, I used to do liposuction. I love the procedure when it's done right. Unfortunately, sometimes it's not done well, and you get irregularities on the skin surface or these contours, and that's usually what patients are asking about. So if you've had liposuction and it's a great job, you just want a little more fat reduction, yes, generally we can accommodate those needs or those wants. If you've had liposuction done, and unfortunately you didn't get the best result, the ideal result, and you have those contours, if we treat those areas, you will still have those contours after the treatment's done.
Okay. So this question is from Melissa, who asks, will CoolSculpting work if I diet and exercise and I cannot lose weight?
Absolutely, Melissa. That is the best way. That you diet and exercise. I had my one patient that I think about all the time when someone asks me that question. She was an aerobics instructor. I wanted her body. So she came, I said, what can I do for you? And when she showed me, she pulled up her shirt. She had a fat pocket around her umbilicus, her belly button, that genetically, that's just where she carried it. She had not an ounce of fat anywhere else on her body. Mm-hmm. So we targeted that area, one treatment, and she was very satisfied.
And she got rid of the fat?
It's gone.
It's gone for good.
Yeah.
It's pretty amazing.
Bye-bye. Don't come back.
Speaking of the results,
yes.
What kind of results are possible, and how much fat can somebody expect to lose with a single treatment?
One single treatment. Well, these are the normal or the averages that we see. 20 to 25% of the fat in that area is reduced. 20 to 25%.
And that's just with one treatment?
One treatment.
Wow.
One treatment. So it's very noticeable. And that's why so many procedures have been done. 3 million procedures. You come and get one, and then you love the results in that area. I have women come back all the time. Okay, I want to treat this area. I want to treat that area. Because they know it works. It was very comfortable, and the results are durable and long-lasting.
And what areas tend to respond best to the treatment? Are there certain parts of the body that it works better on than others? Or
I've seen it work in all areas of the body very well. The most significant results that I see is around the face area, under the chin, that double chin, because that's what you see all the time. So that's where I see the most noticeable results. But as far as good results and what you see, I see great results everywhere.
So amazing to think that this technology can, really improve somebody's body and the way they feel about themselves.
It really is. It really is. And then something that bothers, sometimes patients come in and they'll show me an area, and I say, it looks great.
Right.
But to them, they want a little bit less, and it may be subtle, but so we really need to listen to the patient, and if it bothers you, we'll help you. We'll get it done.
Okay. So we have another question from Amy, and she asks, what areas are FDA cleared for CoolSculpting? All
right, Amy, great question. I have a sister named Amy. All right, FDA cleared. So we start, again, let's start at the top. So the chin area, submental area, double chin area. I had my chin area treated. I loved it. I didn't even know I had a problem. Thank you, Nurse Lisa, for telling me. My nurse pointed out my double chin, and so now I don't have it anymore. So the chin area, submental. And then we have the bra fat here that kind of hangs out from our bra area.
Sure.
Bra fat. The flanks in the back, the love handles, the back fat that's under our bra in the back.
I had that area treated, and it made such a difference. That
Yes.
bulge,
Yes.
you get that
The
fat
bulge.
roll from your sports bras and your bras that shows
That's
through
right.
your shirts.
The
Completely
back
gone.
fat,
Yeah.
gone.
Gone.
Wonderful, wonderful treatment. And a lot of times, again, we don't see that. We're seeing, unless we see it in a picture. Again,
Sure.
a lot of times patients come in the picture. So the other FDA cleared areas are the abdomen and the inner and outer thighs. And then actually underneath the buttocks in that infragluteal cleft called the banana roll, we can treat that area also. The one area, I've had multiple areas treated, And the one area, my lower abdomen, after you've had children and if you've had to have a C-section, and we have that long linear scar at the bottom, a lot of times you can have this little roll or this pooch that comes out above that, and I had that. So I treated that with the, it's a larger handpiece, and it was wonderful, one treatment. It was really nice, but that always bothered me. So
let's check in with Jean and see how she's doing. How are you feeling?
I'm doing really well.
Great. Anything at all?
I feel that there is something heavy on my abdomen. It does not hurt. And I think I'm in the process of going numb.
But no pain?
No pain.
So how many minutes has she been on the treatment for?
So she's been on the treatment about 9 minutes.
Okay. Good.
Right.
All right. So we'll check back in a few
Yeah.
minutes and see how you're doing.
So that falls into that 5 to 10 minutes. That's usually when you have the tingling sensation and when you go numb. So she's 9 minutes. That's perfect.
And then it's just complete numbness.
Smooth sailing from that point on.
Until you get towards the end of the treatment and it's pretty much done, I would guess.
Right.
All right, so we have another question about cost. How much does the CoolSculpting procedure cost?
Great question. Cost always is a factor. You know, I hate that word budget, that 4-letter word. I hate it, but it comes into play all the time. So luckily we have a lot of different size applicators, and so the cost depends on the size of the applicator you use and how many areas you treat. And again, everybody's different. Do you have one area, one central location that you need a small applicator for? Smaller applicators are $700, or do you need a larger applicator? And those run $1,400 to $1,500. How many areas do you need treated, and how many treatments do you need done in one area? So that's all individualized, and we customize everything to the patient when they come in. The average, it turns out, in the long run is about $2,200 per treatment.
Per treatment, okay. And how many sessions, this is another question that we have, how many sessions will a patient need in order to see the end results?
Again, every patient's end result differs. So your end result may be attainable with one treatment, and then someone else's end result you may need 2 treatments because you have a larger pocket of fat, because it, again, 20 to 25% fat reduction in one area with one treatment. So usually my patients, I have about 50% of my patients that use one treatment one time and another 50% that need 2 treatments or desire 2 treatments.
So if you're just joining us, we're here at the ASDS 2016 show with Dr. Ann Zedlitz and Dr. Sarah Jackson, and they are doing a live CoolSculpting treatment with Jean on her abdomen. How are you feeling?
I'm feeling great.
Any pain? A lot of coldness? What can you tell us about the experience right now?
No pain. There's an initial vacuum feeling.
Okay.
You feel pulling of the skin. There is a small tingling that is associated with that whole process, and then it's really quite relaxing to be able to sit down and
get a few
enjoy the
minutes off of the
treatment.
day.
Right.
Busy mom.
That's part of the day.
That's right. Good.
All right, so we have a few more questions that we're going to get to. How many sessions will a patient need, and how long does each treatment physically last when they're in the office?
All right, great question, Elise. So usually it takes about 1 hour. You come into the office, and the full treatment from when you enter and you leave is 1 hour. And we have applicators, the time frame is 35 minutes for some applicators, 45 minutes for another, under the chin is 45 minutes, and then others take a full hour. So usually you're in and out the door in an hour to an hour and a half. Lunchtime. Lunchtime fat reduction.
Okay. We have another question. So how would you explain CoolSculpting to your patients? How does the procedure physically work to get rid of that stubborn fat?
Great. Well, there was a lot of research done at Harvard with doctors Dieter Manstein and Rox Anderson, and they discovered that fat cells are significantly more sensitive to cool temperatures. So they actually have a higher freezing temperature. So if you can capitalize on that, if we can freeze selectively those fat cells and leave the other surrounding tissue unharmed, then we can get rid of that unwanted fat. And actually that's what they've done, and that's what the CoolSculpting technology is, selectively freezing the fat cells while leaving the surrounding tissue, skin, muscle, unharmed, and your body eliminates it gradually in a natural process over the next 1 to 3 months. So it's actually freezing selectively those fat cells.
In the area that's just being treated?
Just in that treatment area.
Okay. So how would you say that CoolSculpting is different from liposuction? Because that's always been, you know, what people
Sure.
go to for fat removal.
Sure. Liposuction is a wonderful procedure, absolutely wonderful. I have done it myself in my practice. And when done well, it's wonderful. But it is invasive, and it is a
it's
surgery.
surgery.
There are risks with surgery. And so this is for people who don't want a surgical option, and a lot of people don't need that much fat reduction. If you, again, targeted areas, pockets of stubborn fat, that's what CoolSculpting is for. And it's non-invasive. And so liposuction, wonderful procedure. But it is a surgery.
Right.
You do have risks.
This is not.
Right.
Big
As you can
difference.
see.
No surgery. And how would you say that CoolSculpting is different from other non-invasive fat-reducing treatments that are on the market right now?
In one simple word, it works. I've had those other machines in my office, and you may have 10 to 15% of those patients respond. That's not good enough for me. It's not good enough for my patients. So I want proven results, time, you know, and that's what CoolSculpting has given us over the many years we've had that technology.
Okay, we have another question that just came in from Lauren, and she asks, what does CoolSculpting feel like, and does it hurt?
All right, Lauren, well, as you can see with John, initially there's some tingling sensation and pulling, but it really wasn't painful, right, John?
Not yet.
Really is not, and I've had it done multiple times. So you have some initial tingling, 5 to 10 minutes, and then the skin goes numb. And then afterwards, during the rest of the hour, there's no pain. We take, and you'll see in a few minutes, we'll take that applicator off, and it's a frozen stick of fat under there. It's like a stick of butter, frozen. We massage that down. There's some redness there. And then you go home, you go do whatever you're going to do. Some places in my practice, I put on an ACE bandage and snug that tissue up. And then some patients, a minority of the patients, post-procedural, 3 to 4 days later, may have a little tingling sensation, itching sensation, burning sensation in the treated areas. I see it generally with the larger.
Normal?
That's normal.
Okay.
It's normal, but it's in the minority of patients. I had it when I had my treatment done. It's usually with the larger applicator. So what do? Well, there's a gel pad that you can use that has lidocaine infused in it, so a lidocaine patch that you can put on that area if you do have discomfort, or an ACE bandage, or even just Spanx you can wear on that area, and it makes it more comfortable. Most patients don't have to do that, but you can do that if you have any discomfort.
Okay, so the next question kind of goes into that same topic of, is there any downtime, and do you have to follow any special post-care instructions after you've had CoolSculpting?
Great. There is no downtime. My favorite patient that I treated, it was her and her mom, and they both came in. They both wanted the treatments done at the same time, so we were able to do that with our 2 machines. And then as soon as they were finished, they got up and they went and worked out. They went to the gym. No downtime whatsoever. You can go shopping, you can go to the movies, you can go back to work, or you can go work out. So absolutely no downtime. What was the second part to that question?
Are there any special post-care instructions that you need to do after you've had the
And we
treatment?
kind of touched on that a little bit, Elise, and the ACE wrap bandages to snug up the area, or Spanx, and that's only if you have discomfort. So you really don't have any post-care instructions. That's pretty much it.
Go about your day?
Go back to your life.
It's pretty
And just watch
amazing.
that fat melt away.
That's pretty amazing.
It is.
Kate has a question for us. Is there a best time of the year to have CoolSculpting done?
All right, Kate, what's the best time of the year? 3 months before you want to look your best. So if you are getting ready for summer season, for swimsuit season, you want to have it done 3 months before that time period, because you will, again, start to see results at 1 month, but the full results aren't going to be until 3 months. And then you have to think, do I only need 1 treatment session, or do I need 2? Everybody's different. So if you have a larger pocket of fat, you may end up wanting or needing 2 treatment sessions. So what does that mean? It means you're going to need to plan for 6 months in advance. So the best time is all year round, but for you individually, it's 3 to 6 months prior to whatever event or season you want to look great for.
So you need to plan this out, look at your calendar, and kind of back into it so you know exactly when you're going to be expecting the results, and time's up with what you needed to time up.
Absolutely. We need more than 2 weeks.
Okay. So do patients have to change their habits at all after they've had the procedure? Is there any recommendations in terms of dieting or exercise that you make them follow?
Sure. Diet and exercise is always important. And you're always going to look your best when you are eating right. And if you exercise a little bit, it's just going to do even more. And again, with this procedure, yes, it's going to do its job. It is going to reduce that fat 20 to 25%. If you want to get even better results, then you diet and exercise. Or diet. I don't like diet. I don't like that word. I like live it. What do you want to do? How do you want to eat for the rest of your life? And, you know, you treat your body well and you give it good food and it's going to treat you well long term. So I like live it and exercise.
Okay. So there's a new applicator from CoolSculpting.
Yes.
What does that mean to patients?
New applicator means less time. So the original treatments were all 1 hour long. The new applicator, the Cool Advantage, decreases that time to 35 minutes. Wonderful. Less time. You can treat more areas in the same amount of time. So it's just really, technology is getting better, decrease the amount of time, and I'm very excited that we have it.
And where can the Cool Advantage be used on the body?
Well, almost anywhere. It's a smaller applicator, and we expect to see larger applicators going down to the 35-minute time. But right now, it can be used almost anywhere except under the chin. That is a special called the Cool Mini applicator, and that one is 45 minutes.
Okay.
But any area where you need a small applicator.
Okay. All right, let's see how Jean is doing.
How are you?
How's the treatment going?
It's going really well. I truly do not feel anything at this point.
So you're totally numb right now?
I'm in the numb zone.
Numb zone, okay.
Yes.
No pain?
No pain.
Perfect.
And that's what we expect with the treatment. This is totally normal. And usually I go in and check on a patient. They're on their phone or they have their eyes closed and they're just really enjoying the peacefulness. A lot of my patients are busy moms, and you have some time to yourself in a quiet room. It's nice.
So we have another question from Jessica, who said that she's getting married in May and she wants to know when should she have CoolSculpting done.
All right, Jessica, so May, again, let's count back on your calendar. So it's probably you want to look great in your dress, and what areas are you going to treat? Is it the back? Do you have a backless dress? Halter dress? Do you have some back fat or some bra fat that may need to be treated with the halter type dress? And then how many treatments do you need? So if it's in May, let's go back 3 months, because 3 months is when you're going to see your optimal results. So, you know, February, March, April, May. So maybe in the beginning of March get treated. And then if it needs to be treated twice, if you have a larger pocket of fat, then you go 3 months before that.
Okay. And we have
Great,
another
Jessica.
question. How long should my session take?
Okay. The sessions take anywhere from 35 minutes to 1 hour, depending on what size area you're getting treated. So the smaller areas, 35 minutes. And so when my patients come in and they're getting a small area treated, which is going to take 35 minutes, they're usually in my office for 1 hour. So we usually get you undressed and change you into these cute little blue shorts. Not really, they're not so cute. But, and then put the gel pad on and take pictures. So it usually takes a few more minutes to get all that done. But generally 1 hour to an hour and a half you're in the office.
So an hour and a half, you're in, you're out, you have the procedure done, you go back to your normal life, and you get rid of the fat.
It's
What could be better?
I know. Well, there's one thing, and there's some researchers out there listening. Invent a pill that we can take, just one pill that can say fat removed from buttocks, fat removed from flanks. I would love that.
That would be amazing. That would be a perfect world.
Okay, I won't hold my breath.
We have another question that came in. Is CoolSculpting like a cryo chamber?
No, cryo chambers. Okay, absolutely not. CoolSculpting, as you can see, is taking cold to a targeted area for fat reduction. Cryo chambers, you go in and your entire body is getting treated with cool. So you're not going to freeze your entire body. This actually freezes the tissue in that small area that then is gradually eliminated by the body. And so it's really two totally different technologies and approaches, and
So nothing alike.
nothing like it.
Okay. And another question that came in is, where can I have this procedure done?
Right. There are many locations around the country, around the world. Like I said, 3 million procedures done, 70 countries around the world. So you can actually go on the CoolSculpting website and plug in your area code or your zip code and find out where there are providers in your area.
Okay. And if you're just coming to Facebook and joining us, We are here at ASDS with Dr. Ann Zedlitz and Dr. Sarah Jackson, who is performing a live CoolSculpting treatment on Jean, on her abdomen. And we've been answering your questions coming in from Facebook. And we have another one that just came in from Lisa, who asks, who is a good candidate for CoolSculpting? Is there an age limit? Do you have to be, 18 plus? Can you be under? What about for seniors? Is there a cap?
All right, Lisa, great question. Very good question. So there are some age ranges, and I may go a little outside those age ranges, but generally 18 to 65 years of age, 20 to 65 years of age. I have had some patients a little bit younger and a little bit older, but those are selected, and so that's the age question. And then one thing that we haven't talked about or touched on, and it was important for me, is postmenopausal women. Your fat is redistributed differently after menopause. I didn't know that. I didn't realize it. I had already heard, but I had always heard, but until you go through it, you just don't realize it. So I went through menopause over 10 years ago, and my shape changed. I used to have a very small waist, and then suddenly I'm like, what is all this around my waist? So I use CoolSculpting to get my waist back. So postmenopausal women, it's a good treatment to get your areas back where you may have accumulated some excess fat storage.
We just got a really good question coming from Connie. She asks, is CoolSculpting covered by insurance, and is any financing available?
Financing is always available. Usually, I know I have two forms of financing at my office, but usually there are many offices have financing available, 6 months, no interest, 12 months. Insurance, don't we wish? But unfortunately, it is a cosmetic procedure. So maybe in the future, I doubt it, but insurance does not cover this procedure. But it's priceless. I mean, what's the cost? Get rid of that unwanted fat? Priceless.
All right, we have another question. What exactly is CoolSculpting? Tell us about this whole treatment.
Yes,
and
isn't it
what
fascinating?
we're doing here today.
Science, technology. So CoolSculpting, it's the only FDA-cleared non-invasive procedure to get rid of stubborn fat, pocketed areas of fat. It actually freezes the fat, and your body eliminates it naturally over the next 1 to 3 months. It's in office. It's very comfortable, as you can see. John's not having any pain. And then the fat, after it's frozen over the next 1 to 2 months, the fat is gradually broken down by natural process in your body and eliminated. It's just a fantastic technology that's been developed by two dermatologists at Harvard University, Dr. Dieter Manstein and Rox Anderson. So thank you guys for inventing that.
We have another question that just came in from Martin, and he asks, where does the fat go?
The fat goes and it's gone and it doesn't come back. Bye-bye, don't come back. But so when the cells are frozen, those cells undergo a process called apoptosis. Apoptosis is cell death. So the cell dies, and the cells are gradually eliminated along with the fat that was inside of them through your body's lymphatic channels, and it gradually goes away. And it's a very natural process. We naturally have cells dying as our aging process, and our body eliminates them naturally. So that's what happens.
Okay, perfect. And tell us a little bit about the results.
The results. Well, we touched on it a little bit earlier. The results, you can expect a 20 to 25% average reduction in that area treated of fat. So 20 to 25% reduction of fat in that area. And the long-lasting, durable, the fat never comes back. Gone, bye-bye, don't come back. And do you ever need it to be retreated?
Okay, that question just came in from Hazel. Do I need to be retreated every single year?
All right, Hazel. Yeah, no, you don't have to be retreated every year. If you gain weight, you may want to be treated, but if you're in the same weight category, generally, no, you do not have to be retreated. And that's great. And that's a lot of bang for your buck in the long run when you go in and you get one treatment and you get long-lasting, durable results. That's what we want.
So when patients come to you for a consultation, and I'm sure they ask you this all the time, am I going to gain weight again? Is it possible to gain weight after I've had the treatment? How do you explain that to them?
You're only going to gain weight if you eat more. So it's, if you maintain your weight, if you do diet and exercise and you're in your normal routine, you're not going to gain weight. So it's pretty much you just maintain your standard, your routine diet and exercise, and you're not going to gain weight.
Okay. And we had another question come in from Tracy, and she asks, if moms who have had a C-section can have CoolSculpting.
Yes, I've had it done. I've
Living
had
proof.
multiple C-sections. I've actually had 2 C-sections, and it is an area of great concern. We see it all the time because you have this linear scar, and it is low in the abdomen, and usually your panties or your swimsuit covers it, but you can still have this little bulge right on top that sometimes tries to come over, and we don't want that. But sometimes it does come over, and these applicators are perfect for that area. I just love it. I love it. And the results are so nice. And generally, though, we like to wait about at least 6 months after you've had that C-section scar.
And you want to be probably at your ideal weight before you choose to have a treatment like this done.
A lot of times, moms, like I said, some patients at or near, a lot of times this is a jump start procedure. You get it done and you see those results and you're fired up and you really want to get on that diet or do that exercise or go walking. And so I see it as a jump start procedure for a lot of my patients.
Okay, we just had another question come in from Kara who says that she's 40 pounds overweight and should she get CoolSculpting or lose the weight first?
Great question. So everybody's different on what they want to do. So when I have a patient come in and ask me that question, I generally say, because this is what I would do, get the procedure done and you can see some results, and then you can, because if that area is fuller than other areas, that's where you have more fat cells in that pocket of fat. So if you get it treated, then you're going to see that result. You're going to be more energized to lose that weight, the extra weight that's needed.
Okay, and we had another question come in earlier about who is an ideal candidate for CoolSculpting. Who can get this done?
Generally, it's good for men and women. It's good for all skin types. So it's really the ideal candidate, again, targeted areas of fat where you have fat pockets. A lot of times, I see a lot of men, it's the flank area and the chin on the men. And women, it's the chin and bra fat and then the lower abdomen. Mm-hmm. And so men, women, all skin types, it's really for everyone.
Okay, so we just had, talking about the chin, a question come in from Joe who asks if CoolSculpting can take down that dreaded double chin.
It actually can, and in fact, when it first came out, we were just treating the single treatment here under the chin this way. Since then, we've started treating 2 times with the applicator here along the jawline, and then we do it on the other side, and we actually see a great definition of the jawline, if you will. So not only this fat here, but you get a definition of the jawline, and you actually double treat this area. So we put the applicator here, and then we put the applicator here on top. We double treat that area. Phenomenal results, and that's what I had done on me.
Your chin area looks great.
Thank you.
So Dr. Jackson, how is Jean doing, and how far into the treatment is she at this point?
Hi, Jean. How are you feeling now?
I'm feeling fine.
Okay, good. So Jean has about 4 minutes left of the treatment, so we're almost done.
It's going by so fast.
Wow.
I can't believe that. All right, we have another question that just came in from Patricia, and
Yes.
she wants to know, are there any side effects from CoolSculpting? If so, what would they be?
All right, Patricia, usually if I get a treatment done, I get the side effects. So usually there are no side effects. You initially, like we say, and you're going to see in a few minutes, when we take off the applicator, you'll have an area of red tissue that's frozen. It's like a stick of butter right there on your abdomen. And so then you massage it. So you may have some redness for a day or two. Not really, not even a day, maybe a few hours. Then you'll have some numbness that can last a few weeks. Some patients do, some patients don't. I had that. The other thing that I had, but I had taken a naproxen, I think, or an Aleve. I had a little bit of bruising on one of my sides where I did the applicator. So that can be a side effect, but we normally don't see that. So I had taken a medication that made my blood thin, and I was more easily susceptible to bruising.
So do you recommend that patients tell their provider what, if anything, they are taking prior to the treatment?
Well, we always do a medical history, so we always need to know what you're taking. So if you are on a medication that makes your skin bruise more easily, you may have bruising, but again, it's not the norm.
Okay.
And then we talk about delayed side effects, meaning 4 or 5 days down the road, some patients may have a little tingling sensation or burning sensation on the area. Again, it's the minority of patients that have that, and we have some good treatment options as far as wrapping that area snug with an ACE wrap, using some Spanx maybe on that area, or even, I know in my practice, we have these lidocaine patches that we use where some numbing medicine is infused in the gel sheeting of the patch, and we place that over the area that's treated, and it gives some good relief for 12 to 24 hours. And generally, that sensation lasts a few days. It doesn't last a long time, but it lasts a few days.
Okay. We have another question from Nancy who asks, how many areas can be treated in one session in one day?
All right, Nancy. Well, it depends on how many machines you have. So if a practice has 2 machines, you can. I've had patients stay in my office for the whole day, and they did their entire body, and they never came back. They didn't have to come back again. Again, it's how many treatment areas you need and how many times that area needs to be retreated. So, and how many machines your physician has in their office. Sure. So if you need 4 treatment areas and you have 2 machines, you're going to be there 2 hours, because you can hook it up here and hook it up here and do that cycle from 35 minutes to an hour, depending on the size of the applicator. The smaller size is only 35 minutes. And then you can rehook up if you have, usually we'll do a couple here around the umbilicus. Then you can take those areas off, hook you up here in the front, and do that treatment and be done with that in an hour. So you can have 4 treatment areas, in a short amount of time, 2 hours.
Okay. Well, I think that we are getting towards the end of Jean's treatment.
Yes, we are. We have about 30 seconds left.
Okay.
And so what we're going to be doing is we're just going to we can get prepared for that moment, and we're going to just gently take the pillow, and once the suction is ended, we have about 18 seconds. So overall, Jean, how do you feel now?
I feel like it's gone well.
Okay, good.
Relatively
All right.
painless.
Perfect. So once it ends, we're going to release the vacuum, and then we're going to be performing a massage. And that massage is probably the most important part of the whole treatment. That massage is what gives the efficacy to the treatment and increases the amount of fat you're going to lose per treatment. All right, so our treatment is complete. And what I'm going to do, Jean, is I'm going to be placing my finger here, and I'm going to release that suction for you. And we're just going to get that. And there we go. And we're going to remove the applicator. Jean, I have a little towel. We're going to remove the gel pad. So this is that sticky gel pad that keeps the applicator in place. And then we're going to wipe some of this sticky gel off so that we can get a really good massage here. And just like Dr. Zedlitz was saying earlier, you've got your stick of butter here. The fat is cooled, and now we're going to begin our massage. And so what we're going to do is we are just going to knead and massage the area, and that helps in the cell apoptosis that Dr. Zedlitz was talking about. All right, how does that feel?
Great. Good. Does it still feel cold?
I don't feel cold.
You don't feel cold? You don't feel
In fact, I'm
numbness?
numb.
You're
Yeah.
totally
I
numb
can
still. Okay.
see Sarah's fingers, but I can't feel them.
So I would say that most patients do feel a little bit of tingling here. They feel a little bit, because the area is actually beginning to thaw as
Okay.
I'm massaging. I can feel the fat crystals are definitely softer now than when I began my massage, and so the area is warming up just a slight bit. And as you can see, the skin is just slightly red, but overall looks great.
And how long do you have to massage the area for?
We do this for about 2 minutes.
Okay. And she doesn't need to do that when she goes home later?
No, there's absolutely nothing to do after the treatment. She can just
Done. Totally
done.
This actually gives her better results when you do that massaging. You actually get better results.
And why is that?
We believe, Doctor, you want to
Sure.
go ahead, tell me?
We believe that
Dr.
that
Jackson.
the crystals that are formed within the fat are helping to break up the adjacent fat cells. So we think that performing the massage helps the fat cells get broken up and increases the number of fat cells that are damaged in the treatment.
Okay.
Okay, it's great. We just garner more knowledge. The more we do and the more we see, the more we know.
It's pretty amazing that in 35 minutes, I mean, from
Really
start
is.
to finish pretty much, she's had the entire treatment done.
Right.
She's targeted the area that she wanted to get rid of the extra fat. She'll be out the door and on her day.
Right, right. Gonna go
Very
exercise?
exciting.
What you gonna go do?
This has been so relaxing. I'm going to just enjoy the day.
You're going to stay here and get another area treated.
And then in 3 months, she has her results. It's pretty amazing.
Wonderful technology.
Pretty amazing. All right, so I want to thank everybody for tuning in and for joining New Beauty and Cool Sculpting. Dr. Zedlitz, Dr. Jackson, and John for showing us just how easy it can be to have a treatment done. We had one more question that just came in before we get ready to go from Anthony, who said, how much weight will I lose?
Anthony, it's not a weight reduction program, but it only targets those areas of fat that are stubborn, those little pockets of fat. So it's really not used for a weight reduction program, but to reduce those number of fat cells in a target, in a specific area, those pockets of fat. But great question.
Okay. So you're still massaging her.
I didn't put a timer. We usually have a timer at the office. So I just want to make sure I get my 2 minutes.
Okay. I wasn't timing it myself either.
Right.
So.
I think it has.
And you're doing a little bit of a different technique now than you did in the beginning?
Well, I like to do a little kneading and also a little bit of like waxing. So we do a little bit of both just to make sure that every crystal is dissolved and he or she feels great. So I think we are done.
Okay. Oh, and we just had one more question come in from Johnny that says, does Cool Sculpting affect people's organs?
All right, Johnny, great question. No, it doesn't affect any organs or any the workings of any organs. Actually, it's a very easy and natural process where the fat and the dead fat cells are eliminated. So it has no effect on any of the organs. And that has been proven by many studies and many tests that have been done during the whole research phase of this technology. Great question.
So people don't have to worry about getting the treatment
at all.
done and having any damage done internally. It's just on the fat.
Right.
Okay. What about treating the inner thighs?
I love that area. It's one of the best. You were asking me about areas that really have a great result, and I mentioned the chin. I love the inner thighs because that area is that's the bane of my existence. You know, when we have to go put on those swimsuits or we put on those little short shorts and you have those that little extra, just a little extra fat there can make a difference. So when we do Cool Sculpting there, it's almost a home run. It's wonderful.
Okay, great. And we had another question just come in.
Okay,
They're all coming in
great.
at the end now.
All right, good.
From Donna, and she asked, when will she see results?
All right, Donna, you will see results. You'll start seeing results. A lot of my patients say 3 weeks. At a month, I see a lot of patients have results, but the full results are 3 months. But normally, you can expect to see results starting in 3 to 4 weeks.
So it's, you know, pretty, I wouldn't say instant because it's not instant, but it's fairly
Close.
It's
So
fairly
close.
immediate.
It is. It really is. You know, to be so comfortable for a procedure and then to have, you know, when you think of the past and the liposuction and the surgery or the months of exercise, and then sometimes that doesn't even get the results that you want. It's a wonderful technology.
So speaking of liposuction, are there people that can have this procedure done if they've already had liposuction done in the past?
Actually, yes, you can. You just want to make sure that if you're concerned post-liposuction about the skin irregularities, when you have some curves and some divots, some bulges and some divots, it usually will not correct that at all. So, but if you just have more fat in that area that wasn't quite removed all the way with liposuction, it is usually a good option.
Okay, that's good to know. And we have one last question. Anita asks, where can I find a doctor who can do Cool Sculpting on me?
All right. You can go to CoolSculpting.com, put in your zip code, and it will give you a whole list of physicians in your area.
Very perfect. So I think that is pretty much all the time that we have today. So I want to thank again Dr. Zedlitz and Dr. Sarah Jackson for joining New Beauty for this very special Facebook Live segment and showing us how easy it can be to have a Cool Sculpting treatment done. As Jean just showed us on her abdomen, 35 minutes, no pain, in and out. And if there was any questions that were not answered during the session, we'll be answering them in the comments below. And to find a provider who can give you a session of Cool Sculpting, please visit their Facebook page or CoolSculpting.com. So thank you both so much.
Thank you
and
for
thank you
having
for
us.
tuning in. Until next time.